Welcome, everyone, to Masters of Medicine. This is a special series from White Coat Hackers Media.
It is.
And in this program, we're getting to know some of the people who've really made significant contributions to world health sciences. We try to understand their work, why it matters.
And why it still matters today, absolutely.
This is our second conversation in the series, and today our focus is on a, well, truly remarkable figure, Dr. Paul Farmer, an American medical anthropologist and physician.
That's right. And preparing for this, we've been looking through quite a bit of material, biographical info, summaries of his work, especially with partners in health. It's quite a story.
It really is. And our mission for you listening is to give you a real sense of Paul Farmer's unique, maybe even revolutionary approach to healthcare for the world's poorest people.
And the huge legacy he's left in global health. It's pretty profound.
Okay, so ready to jump in. Where do we start with someone like Farmer? I guess the beginning, his early life.
Yeah, his early life, it was definitely not typical. Born in North Adams, Massachusetts, but he grew up mostly down in Florida.
And the sources mention some unusual living situation.
Airy. For a time, they lived in an old school bus. His father, who sounds like, well, a free spirit, had converted it.
Wow.
And then later, a houseboat anchored in a bayou. So, yeah, unconventional.
Living on a bus than a boat. That definitely makes for a different kind of childhood. You mentioned financial difficulties came with that lifestyle.
Apparently so, yeah. Wasn't easy. But interestingly, his parents really pushed learning. They read serious literature to the kids.
So there's this mix of kind of financial struggle, but also intellectual richness.
Exactly. Resourcefulness, hardship, but this deep intellectual grounding alongside it. You have to think that environment really shaped his view of the world, inequality, life, right from the start.
Yeah, it makes you wonder how that fed into his later path. There's a specific mention of one summer working with Haitian migrant workers, picking citrus fruit.
Yes, that comes up as a really pivotal early moment. His first real encounter with Haitian people, it seems like it was more than just a job. It sparked something, a connection, a curiosity.
And after that, he did well in school. Graduated high school.
Elected senior class president, actually.
Okay.
Then went on to Duke University. He was a Benjamin N. Duke Scholar there.
Impressive.
And graduated summa cum laude in 1982. His major, medical anthropology.
Ah, so that blend, medicine and anthropology, it was there right from his undergrad years.
Absolutely. And while he was at Duke, he also spent time over in Paris, learned French, which, turned out to be incredibly useful later on.
Right. But Duke wasn't just about the degree, was it? There were some key intellectual influences during that time.
Definitely. Two big ones stand out from the reading. First, he discovered Rudolf Virchow.
Verrer, 19th century German physician, founder of public health medicine, sort of.
That's the one. Virchow's big idea was that disease isn't, purely biological. It's deeply tied up with social conditions. Poverty, politics.
He had that famous quote, right? Medicine is a social science.
And politics is nothing but medicine on a large scale.
Yeah.
That clearly resonated with Farmer.
You can see the direct line to Farmer's later work there, connecting health to the bigger picture. What was the second major influence?
Well, it was also the political atmosphere of the time. This was the era of intense civil wars, revolution in Central America, and alongside that, the rise of liberation theology.
Liberation theology.
Yeah.
That term comes up a lot with Farmer. How exactly did that shape his thinking about healthcare?
So liberation theology, especially coming out of Latin American Catholicism, it stresses the preferential option for the poor, meaning that focusing on the well-being, both physical and spiritual, of the poor isn't just like a side issue, it's central. It's about actively helping the least fortunate. For Farmer, this wasn't just theory. It became a powerful moral compass.
A moral imperative.
Yes, he saw healthcare not as charity, but as a basic human right, especially for those pushed to the margins, the poorest.
Okay, so Virchow provides this intellectual framework, the social determinants of health, and liberation theology gives him the kind of moral fire to act on it for the most vulnerable.
Perfectly put. And around the same time, while he was still near Duke, he had another key encounter.
Right, with Sister Juliana de Wolf.
Yes, she was working with United Farm Workers, trying to improve conditions for tobacco laborers nearby, and through her, he got connected again with Haitian farm workers.
Revisiting that connection from his summer job.
Exactly. But this time, he started really listening. learning Haitian Creole, diving into Haiti's history, its struggles. And that experience really solidified Haiti in his mind as the place where these ideas about justice and health really needed to be put into practice.
And that led him straight to Haiti after graduating from Duke.
Pretty much. He went to Conge, a village in Haiti's Central Plateau, a really impoverished area, and started volunteering at a small hospital there. But he didn't stop his education.
No, he went on to Harvard, right, for both an MD and a PhD.
Simultaneously, MD and a PhD in medical anthropology, earned them both in 1990, which is just incredible dedication.
Wow. Doing both at that level. And he kept going back to Cange during medical school. He wasn't just studying about it.
No, he was living it, seeing the clinical side, the anthropological side, how they fit together. And he completed top-tier medical training, too. Residency in internal medicine, then a fellowship in infectious diseases at Brigham and Women's Hospital in Boston. Board certified in both.
So he emerges as this fully trained, world-class doctor, but with this incredibly unique anthropological perspective layered on top.
Exactly. And it was during that intense time, juggling Harvard, the hospital training, the trips back to Haiti, that the idea for Partners in Health really came together. PIH.
Right. Co-founded in 1987. Who else was involved in starting it?
Key collaborators were Jim Yong Kim, Ophelia Dahl, Thomas J. White, and Todd McCormack. Their mission was, well, ambitious from the start. Provide direct health care, definitely. But also, crucially, do research and advocacy for the poor and the sick. Not just about them.
And their first big project was essentially formalizing and expanding the work in Cange through Zanmi Lasante.
Exactly. Zanmi Lasante, that's Haitian Creole for Partners in Health. And their work there, it went way beyond just running a clinic.
How so?
They understood health was linked to everything. So they built schools, houses, put in sanitation systems, clean water projects, vaccinated kids, malnutrition rates dropped, infant mortality plummeted.
It was holistic, addressing the whole picture.
Totally. And they tackled the big infectious disease challenges head on, especially HIV/AIDS, which was devastating Haiti at the time.
And they had real success there, didn't they? Even with limited resources?
Remarkable success. They showed you could achieve great public health outcomes even in extreme poverty. Like, they got mother-to-child HIV transmission down to just 4% in their catchment area. That was huge. It was proof of concept. High-quality care was possible.
So that success in Haiti, it wasn't just a one-off. It became the blueprint, right?
Yeah.
The model PIH started to take elsewhere.
Precisely. What they developed in Cange wasn't just treatment. It was a whole new way of thinking about delivering care in places everyone else had written off. Community-based strategies.
And they started applying this model in other countries, like Peru. The sources mention work starting there in the mid-90s.
Yes, 1994 in Caraballo, a shanty town outside Lima. And Peru is where they tackled another huge, seemingly impossible problem, multi-drug-resistant tuberculosis, MDR-TB.
Which at the time was basically seen as untreatable in poor settings, right?
Yeah.
Too complex, too expensive.
Completely. The conventional wisdom was you just couldn't do it. The drugs cost too much, the treatment took too long, patients wouldn't adhere to it. It was seen as a death sentence.
But Farmer and PIH didn't accept that.
Not at all. By 1996, working with their Peruvian partners, Socios en Salud, they developed a program that successfully treated MDR-TB patients. They proved it could be done.
And that must have caused ripples in the global health world.
Big ones. Their results were undeniable. So much so that the World Health Organization, the WHO, appointed Farmer and Jim Yong Kim in 1999 to help get global MDR-TB programs going.
Which then led to significant funding. A big Gates Foundation grant.
Huge. $44.7 million, specifically to push MDR-TB research and treatment initiatives forward in Haiti, Peru, and also Russia.
And their work wasn't just about the medicine, it was about the system needed to deliver it, wasn't it?
That was Farmer's crucial insight. Yes, they showed it was medically possible and even cost-effective to treat MDR-TB in poor countries. But, and this is the key, only if you built the whole system around it. Meaning social support. You needed functional delivery systems, yes, but also things like housing support, food stipends, transportation help, community health workers checking in. Everything needed to help patients stick with that really tough, long treatment regimen.
It goes back to Virchow again. You can't just treat the disease in isolation.
You have to treat the context, the poverty, the social conditions.
And PIH kept expanding. Beyond Haiti and Peru, Rwanda comes up frequently.
Yes, Rwanda became another major site. Farmer was deeply involved in establishing significant health infrastructure there. He was key in opening the Butaro Hospital in 2011, a major project with the Rwandan government.
And also in Haiti, the Mirabelet University Hospital.
Right. Hôpital Universitaire de Mirabelet opened in 2013, a state-of-the-art teaching hospital offering advanced care like oncology, trauma surgery. A huge step.
And Rwanda was also the site for the University of Global Health Equity, right? UGHE.
Yes, UGHE. Launched in Mutaro in 2015. This was really Farmer's vision for training the next generation. It focuses on teaching health professionals to deliver quality care by tackling the social and systemic inequities head-on. He was its chancellor.
So PIH's reach extended quite far. Lesotho, Malawi, Mexico.
Sierra Leone, Liberia, even working with the Navajo Nation in the U.S., the model proved adaptable.
Looking at his overall approach, that dual-role physician and anthropologist seems absolutely central. What were the core concepts he really championed?
Well, community health workers were huge, training local people, empowering them to provide care and support within their own communities. It decentralized care, brought it closer to home.
Took it out of just clinics and hospitals.
Exactly. And he wrote so much, always hammering home the links between health and human rights, between social inequality and who gets sick, who gets treated, who survives.
The term accompaniment is often used to describe his philosophy. What did that really mean on the ground?
Accompaniment.
Yeah.
Yeah, that was core. It wasn't just about giving out pills. It meant walking with patients, being present, supporting them through their struggles socially, emotionally, materially, not just medically.
Like solidarity.
Deep solidarity.
Yeah.
And deep humility, standing with the vulnerable, not just treating them from a distance. You can really see the influence of liberation theology there.
And he also operated on the global stage, taking on UN roles.
He did. He was Deputy Special Envoy to Haiti for the UN, working under Bill Clinton from 2009 to 2012.
Right after the earthquake.
Yes. And then from 2012, he became a UN Special Advisor on community-based medicine, focusing on lessons from Haiti. A big part of that role was tackling the cholera epidemic there.
And even much later, during the COVID-19 pandemic in 2020.
He was applying the same principles back in the U.S., helping PIH set up a contact tracing program in Massachusetts, showing that community-based approaches weren't just for poor countries, they were essential everywhere.
Given all this, it's no surprise he received so many awards and honors. The list is long.
It's incredible. I mean, the MacArthur Genius Grant, the Hilton Humanitarian Prize for PIH as a whole, the Public Welfare Medal from the National Academy of Sciences.
And that Berggruen Prize for Philosophy and Culture, $1 million.
Yeah. Plus, membership in all the prestigious academies, American Academy of Arts and Sciences, National Academy of Medicine, American Philosophical Society. It shows the breadth of his recognition.
He was also a really influential writer, wasn't he? Documenting the problems, but also pushing for solutions.
His books are essential reading in global health. AIDS and Accusation, Infections and Inequalities, Pathologies of Power. He constantly connected present-day health crises back to history.
Like in Fevers, Feuds, and Diamonds, about Ebola.
Exactly. He showed how centuries of exploitation and failure to invest in basic health systems in West Africa created the conditions for Ebola to explode. He wasn't just treating symptoms, he was diagnosing the deep historical and structural causes of poor health.
And of course, many people discovered him through Tracy Kidder's book, Mountains Beyond Mountains,
which famously called him the man who would cure the world. It really captured his relentless drive.
Just briefly touching on his personal life, he was married to Didi Bertrand Farmer.
Yes, Wingdi Didi Bertrand Farmer. She's also a Haitian medical anthropologist and community health expert, very much a partner in the work, leading her own initiatives, especially empowering women and girls in Haiti and Rwanda.
They had 3 children, and his faith, Catholicism, was important to him.
It seems so, particularly how it connected to that liberation theology framework and his sense of justice.
His death in 2022 felt incredibly sudden, a real shock to so many.
It really was. He died in his sleep, an acute cardiac event in Butaro, Rwanda, February 21st, 2022. He was only 62.
And he was working right where his passion was at the University of Global Health Equity in Butaro.
Yeah, doing what he loved, where he believed it mattered most. His passing left a huge, noticeable void, no question.
Absolutely. So if we try to synthesize his impact, it really boils down to that core conviction, doesn't it?
Healthcare is a human right, period.
He spent his entire life proving that wasn't just a nice idea, but something achievable. That high-quality, dignified care was possible, even necessary, for the poorest people in the toughest places.
And he didn't just preach it, he lived it. Spent years living and working in Haiti, in Rwanda, mentoring, accompanying, building capacity.
Paul Farmer fundamentally changed how we think about global health. about infectious disease,
Yeah.
about social justice in medicine.
He challenged the excuses, the idea that some lives matter less, that good care is somehow too expensive for the poor. His idea of accompaniment is such a powerful counter to that.
It really makes you think about those connections he constantly drew. History, poverty, power, and how they play out in people's bodies and their health.
Definitely.
So maybe a final thought for you listening. How do those forces, Paul Farmer identified the deep inequalities, the legacies of history. How do they still shape health today? Maybe in ways or places we don't always see. And following his example, what's our responsibility in trying to change that?
It's a question that feels more urgent than ever, I think.
Well, that brings us to the end of this look at the life and legacy of Dr. Paul Farmer. We really hope this conversation gave you some insight into his incredible work.
We do. It's a story worth knowing.
And if you're interested in hearing more about individuals who've profoundly shaped health sciences, please do subscribe to the White Coat Hackers media channel. That way you won't miss future conversations in our Masters of Medicine series.
Thanks so much for joining us today.
Till next time.